to uphold the name of our profession, and for neatness and splendor, you for understanding, and for responsiveness.
Nurses and midwives as frontline health workers remain most vulnerable. Worthy of note is that over 5,000 nurses and midwives lost their lives during the 2020 COVID-19 pandemic, a global threat which exposed the weakness of the health sector due to notable underinvestment in health systems around the world. The 2022 theme for International Nurses Week calls on the need to invest in nursing, to build a resilient, highly qualified workforce and protect nurses' rights in order to transform the health sector system, to meet the health needs of the individuals, communities, and the future of this country. It is obvious that nurses are working under terrible conditions and have suffered tremendously through pandemic. They have suffered setback due to delayed proper grading of nurses, which incidentally, during the NCE meeting held in January 24 to 28, as I'm talking to you, the enabling circular is yet to be released, and we are calling on the Office of the Head of Service to release this enabling circular to help the nurses and midwives achieve a better place when you talk about conditions of service. Nurses have equally faced series of attacks, victimization, kidnapping, understaffing leading to workload, insecurity, which accounted to thousands of nurses migrating to developed countries since 2019 to 2022. Almost over 5,000 nurses have left the country and are still living on daily basis, causing a serious brain drain to the country, which should not be allowed to continue in such a manner. The health facilities need well-trained and motivated workforce, consistently available to provide desirable health care for better patient outcome.
Pick their phones, walk close to midwives to say thank you for making me being alive. Because without a midwife, you and I cannot be alive. The president of Nigeria, the president all over the world cannot be alive without midwives. In Nigeria, the absence of midwife, most especially in the primary health care setting, has contributed immensely to increased rate in maternal and child health mortality, so due to complications from pregnancy and childbirth. These deaths are preventable if there are enough individuals working in the primary health care centers. According to WHO, the maternal mortality rate of Nigeria is 814 per 1,000 live births. 814 per 1,000 live births. The lifetime risk of Nigerian women dying during pregnancy, childbirth, postpartum, and post-abortion is 1 in 22, in contrast to lifetime risks in developed country, which is estimated as 1 in 4,900. The National Association of Nigerian Nurses and Midwives wishes to use this period of the Midwife Day to celebration to urge the government of Nigeria to holistically verging into primary health care system in Nigeria, where primary health care centers are manned by midwives to stem the embarrassing increase in maternal, child, and neonatal mortality rates in the country. The training of midwives, equipping them with cognate knowledge of all health challenges associated with pregnancy, providing support throughout the entire labor and birth process. The government should foster the morale of midwives through appropriate funding, functional equipment, and effective remuneration.